Severe allergies, such as shrimp and seafood allergies, can lead to a condition called anaphylaxis. When patients come to us at a community hospital or a small clinic, they may present with facial swelling, difficulty breathing, and symptoms like fainting. If we manage the patient correctly, we consider the condition known as anaphylaxis, or severe allergy, and we start administering a medication called adrenaline, injected into the thigh, which can help save the patient's life. This is crucial in emergency medicine, where we follow a step-by-step approach. The first thing to administer is adrenaline. Some people might think that if a patient is allergic, they should just give antihistamines, such as CPM or steroids, but this decreases the chances of survival. Therefore, anaphylaxis or severe allergic reactions are important topics we need to discuss. People can be allergic to many things, including shrimp, crabs, peanuts, or medications. Now, how do normal allergies differ from severe ones? There are key differences. I want to emphasize the concept of organ failure. Remember this term. Organ failure in allergic reactions means that a normal allergy might just involve a bee sting causing a rash. On the skin, the allergic reaction may only present as itchy red rashes, which is not related to organ failure. What organs are essential for human life? There are two important organs. The first is the heart. The heart system pumps blood. And if the cardiovascular system and heart fail, what happens? Blood pressure drops. The allergen will enter the immune cells called mast cells, which remember that the person has previously had an allergy to shrimp. They will release a chemical called histamine, which causes blood vessels to dilate. When blood vessels expand, blood pressure drops. Normally, our body maintains blood pressure because blood vessels constrict and relax. But histamine causes blood vessels to dilate excessively, leading to a significant drop in blood pressure. There is a term called distributive shock, which refers to low blood pressure due to the dilation of blood vessels. This condition is specific to severe allergic reactions. Additionally, you may have heard of blood infections, which can also lead to distributive shock because the chemicals can cause blood vessels to dilate. We will not go back to this situation. Have you ever seen a patient in shock from blood loss? Some patients, after a car accident, may lose a leg and bleed. When blood is lost, the peripheral blood vessels constrict to redirect blood to the heart and brain. If you check the extremities of someone in shock, or who has had severe diarrhea leading to low blood pressure, their hands and feet will feel cold. This is different from patients experiencing severe allergic reactions, or anaphylaxis, where the extremities will feel warm. This condition is referred to as distributive shock. Patients may initially present with symptoms like dizziness or fainting after eating shrimp, and their lips may appear pale. They may also have warm skin, and when we measure their blood pressure, it may show a rapid pulse. This raises suspicion of severe allergic reactions, indicating that there is an allergy with organ failure. Another aspect is related to the lungs. In this case, the failing organ is the lungs, leading to difficulty breathing, such as experiencing bronchoconstriction. If someone eats shrimp, histamine causes bronchoconstriction, and the patient will present with fatigue and difficulty breathing. In this drawing you can see that people can be allergic to many things. However, severe allergies are related to organ failure. For example, if someone has asthma, they may come in with difficulty breathing and wheezing, but if they eat shrimp or peanuts and their bronchial tubes constrict, it indicates a severe reaction, which is known as anaphylaxis. In this image, I drew a bee. A bee sting can also cause severe allergic reactions. For instance, if a child gets stung, their lips may swell, their face may become puffy, and they may start to have difficulty breathing. This falls under the diagnostic criteria for anaphylaxis. The first thing to do after ensuring the airway is clear is to administer a medication called adrenaline. In cases of severe allergies, we choose a vial that contains 1 milligram of adrenaline. We do not give 1 milligram directly. We select a vial that has a concentration of 1 to 1,000. We choose the dosage at 0.01 milligrams per kilogram of body weight. For example, it's easy to remember that half an ampule is used. If the patient weighs 50 kilograms, then you take 0.01 multiplied by 50, which equals 0.5 milligrams. You can calculate it easily. 0.01 times 50 equals 0.5 milligrams. 1 ampule is equivalent to 1 milligram, so we need to administer 0.5 milligrams, which is half an ampule. There's a technique to remember this easily. My senior taught me to remember it as half an ampule because anaphylaxis or severe allergic reactions are emergencies that can be life-threatening. If we only remember the medication notes, the patient might die before we can act. So remember the ampule. After that, the calculation is straightforward. 0.01 milligrams multiplied by 50 kilograms equals 0.5 milligrams. When injecting adrenaline, we need to inject it into the thigh, not the arm. The injection site should be on the outer side of the thigh muscle, avoiding the inner side where the nerves are located to prevent hitting a nerve. We recommend injecting into the thigh muscle because the thigh muscle is large, similar to the muscles of someone who works out their legs. A larger muscle has more blood supply, so when we inject adrenaline, the blood will carry it quickly, allowing the medication to take effect rapidly. This is important because the patient is in shock, and we need the medication to act fast. However, if we inject into the shoulder, the effect will be slower because the shoulder muscle is smaller. Injecting into a small muscle, like the shoulder, can be similar to getting a vaccine, and the medication may take longer to work. Additionally, we use a very concentrated solution of adrenaline, 1 part per thousand. If we inject into the shoulder, which has a smaller area, it could lead to reduced blood flow in the muscle, which is not ideal for anyone, whether a child or an adult. Therefore, we should inject into the thigh. This part discusses the mast cells, which release a substance called histamine. For example, if someone has a history of shrimp allergy and then consumes shrimp derivatives again, the mast cells will release a chemical called histamine. The reactions can vary. Some people may experience mild rashes, while others may have severe allergic reactions or anaphylaxis, which can lead to difficulty breathing, systemic failure, and low blood pressure, resulting in fainting. Some may also experience nausea and vomiting due to the dilation of blood vessels in the abdomen and intestines, leading to symptoms like dizziness and nausea. The medication given in such cases is usually adrenaline if a severe allergy is suspected. Following that, antihistamines, such as CPN, are administered. CPN is an antihistamine that counteracts histamine released by mast cells. However, this medication does not act immediately. It takes some time to show effects. The first thing to administer is adrenaline if a severe allergy is suspected. For instance, in the case of a child with significant swelling of the lips, if left untreated, this could lead to swelling of the tongue, which may obstruct breathing. Therefore, we consider this a severe allergic reaction due to the significant swelling that could compress the airway. This is the medication, right? The dosage is 0.01 milligrams per kilogram of body weight. For an adult weighing 50 kilograms, that would be 0.5 milligrams, or half an ampule of adrenaline. For children, the calculation should not exceed 0.3 milligrams per kilogram of body weight. It's important to remember that for children, the dosage is 0.01 milligrams. To explain it simply, for adults, we do not give more than 1 ampule. If we calculate for a child and it exceeds half an ampule, it would be concerning. The maximum dosage for a child is 0.3 milligrams. For example, for a child weighing 30 kilograms, we multiply 0.01 by 30, which equals 0.3 milligrams, and we inject it into the muscle, not into the bloodstream. Injecting into the vein is very rare. It should be done by a specialist, which I have never done. We usually administer it intramuscularly. It's better to inject into the muscle rather than into the vein. If there is a severe allergic reaction, it should only be done by a qualified doctor. Now, when we inject the medication, most of the time, the patient improves. I remember a case of a strong foreign patient who was very muscular and had experienced severe allergic reactions multiple times. He came to me in the emergency room with a severe allergy, red patches on his face, and low blood pressure, feeling faint. I injected him with half an ampule, right? Half an ampule, which is 0.5 milligrams, but it didn't help. The patient told me that. Normally, they inject 0.7 milligrams, And if the weight is over 10 kilograms, then after about 5 minutes, they inject again. After 3 to 5 minutes, they do another injection of 0.7 milligrams, and that usually resolves the issue. And this will say that the body weight is half an app, which is a state subject, but it really needs to be calculated, because if it's too low, it may not improve if the dosage is too small. Next, other medications like antihistamines are also given, but I will talk about inhalers because the respiratory system may have diseases. There are two types of bronchodilator medications, Ventolin and Moridorol. How are they used differently? Ventolin, or salbutamol, acts quickly as a beta-2 agonist, allowing the bronchi to dilate rapidly. We should start with Benadryl first to help the bronchi expand. Normally, when you inject a Redin, the patient will experience an improvement in their overall health and well-being as it helps alleviate their condition. Now let's discuss the EpiPen, a crucial device. There are some patients who experience severe allergies on a frequent basis, such as young children or those who have regular allergic reactions. They require a critical, life-saving medication that acts quickly in a timely manner, which is the pen containing adrenaline. In various other countries, there are specialized packages for administration that allow you to inject it directly into the thigh. However, in Thailand, the use of EpiPen is not as common. There are concerns and doubts about the process of self-injection in the thigh, so in Thailand, they have adapted by utilizing a syringe with a needle, a more traditional method. Sometimes when we find ourselves in the hospital emergency room or clinic, a child might come in with a severe and potentially life-threatening allergic reaction. If they recover, they might use the pen to help themselves, but if the medication runs out, they will come back the next day to ensure their safety. We then prepare the medication by carefully mixing it according to their specific medical needs and requirements. For example, drawing adrenaline at 0.5 milligrams or 0.3 milligrams for children, and safely storing it in a secure and safe manner in a secure box for future use that should contain 2 needles of different sizes. This is important in the event of a medical emergency. If the first injection doesn't work, they might need to use the second one. You can use it if they have symptoms at home, or in another case, if they are excited and having trouble breathing, just grab the medication. If you inject it and it doesn't work, you might need a backup needle. If you only prepare 1 needle and make a mistake, you won't have a backup plan, so you should have 2 needles ready. Also, prepare equipment like gauze and cotton to cover wounds and make sure to disinfect. If you have time, you should clean everything. If not, just go ahead, because our lives come first. As mentioned, it could lead to severe allergic reactions. So it's important to monitor for organ failure. Another possibility is that sometimes when we give adrenaline the first time, it doesn't work. And even the second time, it might not work. In this case, saline could be given if blood pressure is still low. As you mentioned, dysthymia can cause blood vessels to dilate throughout the body, including in the abdomen and legs, which can affect blood pressure. Don't go back to the country, hey, if we give saline, right, you see? Inject this saline into the bloodstream. It's true that the blood may still be pooling in the legs, so therefore we might give saline to help it rise. This process is known as fluid resuscitation. If we need to give saline, it should be in the vein, and it can help bring it back to the heart. Therefore, in conclusion, it may increase the output from the heart, and the blood pressure may return. This is called preload. We give saline, not diuretics. We give saline multiple times, and if we give it and the medication doesn't improve the situation, think about saline. That could help increase the blood pressure, but we should also consider antihistamines like CPN and Dexan, which are antihistamines. This is indeed a matter for the future. Severe allergies. I once read about a case where a patient went to a certain place and received an injection, then had a severe allergic reaction with chest tightness and feeling faint. If my memory serves me correctly, the patient had issues. If we go back, if we are knowledgeable about treating severe allergic reactions, we should manage the injection properly, starting in the thigh. It can alleviate the worsening condition, but if we are allergic and not precise about the treatment rights, once a severe allergic reaction occurs, shock happens. We start administering saline and other treatments first, and then, ultimately, the patient's heart stops. And we go to give them DMT, but by then it's too late. I think it's like alleviating the cause, often letting it go before the situation escalates. If we don't choose the right treatment, it's crucial to diagnose correctly. It's quite severe after administering certain medications like antihistamines and some antibiotics, leading to facial swelling and shortness of breath. We measured the blood pressure and it was low, which relates to system failure. heart failure, vascular failure, and low oxygen levels in the lungs. In this case, we should start administering adrenaline right away, injecting it into the thigh. For adults, we give half an ampule, which is 0.01 milligrams. Then we can slowly administer saline and monitor the patient. At least the patient might improve from shock. They may not be in shock anymore, and they could get better, which is certainly better than not doing anything. This is the content regarding emergency medical treatment. Let's meet again next time in the consultation.